Hey everyone. Today, I'm diving into the fascinating world of Burkholderia pseudomallei, a bacterium that causes melioidosis. This is a highly infectious pathogen with serious health implications. Let's break it down. Burkholderia pseudomallei is a gram-negative, rod-shaped bacterium. It's primarily found in the soil and water of tropical and subtropical regions, especially in Southeast Asia and northern Australia. It's known for causing melioidosis, a disease that can affect a variety of organs, including the lungs, liver, kidneys, and bloodstream. Humans can become infected with B. pseudomallei through contact with contaminated soil or water, often through open wounds or by inhaling airborne particles. The bacterium can also enter the body through ingestion. Once inside, B. pseudomallei can cause pneumonia, sepsis, and even abscesses in organs. Symptoms range from mild to severe, and the infection can sometimes lead to death if not treated promptly. One of the challenges with melioidosis is that it can mimic other infections, making it difficult to diagnose. Biomedical scientists use a variety of techniques to identify B. pseudomallei. These include biochemical tests, PCR, polymerase chain reaction, and MALDI-TOF mass spectrometry, which helps to rapidly and accurately identify bacterial species based on their unique protein profiles. In the laboratory, Burkholderia pseudomallei grows well on blood agar plates, where it typically forms smooth, moist, and cream-colored colonies. It's oxidase positive and catalase positive, and it can be differentiated from other similar bacteria through biochemical tests, such as lactose fermentation and nitrate reduction tests. Diagnosing melioidosis often involves blood cultures, sputum samples, or biopsies from infected tissues. The differential diagnosis can be tricky, so prompt laboratory identification is essential to ensure the correct treatment. Melioidosis is treatable with antibiotics such as ceftazidime, meropenem, and trimethoprim sulfamethoxazole. However, treatment can be lengthy and intensive. Patients typically receive IV antibiotics during the acute phase and then transition to oral antibiotics once their condition stabilizes. Biomedical scientists also play a key role in researching how Burkholderia pseudomallei interacts with the immune system and identifying new treatment options. As drug resistance becomes a growing concern globally, understanding how bacteria like B. pseudomallei evolve and respond to antibiotics is crucial. People who work in agriculture, construction, or environmental research in tropical regions are at increased risk. Wearing protective clothing, using gloves, and avoiding contact with contaminated water and soil are essential measures to reduce the risk of infection. Though melioidosis is not common in many parts of the world, it remains a serious public health threat in areas where Burkholderia pseudomallei is endemic. Ongoing research is key to better understanding the bacterium and developing more effective prevention and treatment strategies. Don't forget to subscribe to Science for Fun Academy for more educational content. Thanks for watching.